A very good evening to one and all. Welcome back to the today's session. So today we have Dr. GANATRA sir, Assistant Professor from Department of Organon of Medicine and NABH Coordinator, Sainath Homeopathy Hospital. So Rajkot Homeopathy Medical College, Parul University. We welcome you sir. We welcome you all the participants. So we'll be looking forward for your today's session sir. Over to you Ashika.
Hello.
Yes, Ashika. Yeah, you are audible. Kindly please take the control. Yeah.
Evening to one and all. So, welcome you all to Homeovision webinar series organized by All India Homeopathic Student and Youth Association. And today we have with us our guest speaker, Dr. NIRAV Ganatra sir. He is Assistant Professor at the Department of Organon of Medicine in Rajkot Homeopathic Medical College, Parul University, Gujarat. He is a member of Board of Reviewer in UGC approved journal, namely Journal of Emerging Technology and Innovative Research. He is member of Board of Reviewer in UGC approved journal, International Journal of Research and Analytical Reviews. He is also Board of Reviewer in UGC approved journal, namely International Journal of Innovative Research in Technology. He has been a paper presenter and poster presenter at Jaipur, Pune, Parul University, Kanyakumari, Calcutta, Kerala, and he is also be an honorary speaker. uh, Hello. And he has also published articles in National Journal of Homeopathy, International Journal of Trend in Scientific Research and Development, Homeopathic Heritage Journal of Emerging Technologies and Innovative Research. He has published articles even in International Journal of Research and Analytical Reviews, International Journal of Innovative Research in Technology, Homeo Times, Vital Informers, and etc. etc. He has also been a coordinator in organized various webinar series in collaboration, such as in collaboration with Parul University. He has also um, he has also been a coordinator in celebrating World Autism Day as a roundtable discussion webinar in association with National Journal of Homeopathy and Rajkot Homeopathic College, Parul University. So, over to you, sir. We will start today's session, and today's topic will be from agony to alleviation, a homeopathic perspective on pain management. Over to you, sir.
Thank you, Madam Ashika, Madam, for the introduction. Thank you, Lavanya, Madam, and Goswami, sir, for providing such an opportunity to present over the platform of the AIHSAYA webinar. And moving on to the first topic, that is agony to alleviation, homeopathic insights on the pain management. This topic I have chosen for a particular reason that we have observed various types of pain in various types of conditions, and in our repertoire also there is presence of wide range of variety of the pains and specific remedies for particular type of the pain. This particular type of the pain helps us in characterizing the patient, helps in the individualization of the patient, and helps in the selection of the simillimum remedy which is available for the patient, and helps the patient's agony to release, to free himself from the agony and to alleviate his lifestyle for achieving the higher purpose of life. So that's why this topic I have chosen. We will go through first of all the regarding the epidemiology of the pain, that in which type of diseases, how much type of pain, and what type of pain is present. Then we will be seeing about the organon point of view, where Master Honeyman has explained us regarding the characteristics of the pain, importance of characterizing and individualization of the pain, and choosing the simillimum on the basis of the type of the pain present in particular type of the disease. Then we will also see the repertorial approach, and along with that, we will be completing our three-legged stool by viewing the materia medica aspect of the pain management. Let us move on. First of all, what is pain? Pain, as defined by the International Association for the Study of the Pain, that is the IASP, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. When there is any kind of damage in our body at that particular type, pain has been experienced by an individual. It is the unpleasant sensory and emotional experience associated with actual or potential tissue damage. That means there is some disturbance in the structural changes of the tissue, functional changes of the tissue, and that tissue damage leads to the production of the unpleasant sensory feeling associated. If we see the sensory and motor feelings which are present in our body, pain is a type of an unpleasant sensory and emotional experience which is leading to the development of the changes in the psychological aspect of the patient also. So pain is ultimately an unpleasant sensory and emotional experience associated with actual or potential tissue damage. If we see the epidemiology, it is an enormous problem globally. If we see 20% of the adults suffer from various type of pain and 10% are newly diagnosed with chronic pain every year. This pain may be associated with rheumatoid arthritis, also osteoarthritis, or with any kind of the particular diseases which are causing functional disabilities in an organism. A prevalence of pain in patients visiting primary health centers in central India was marked 29.63%, and chronic pain among these patients was 19.23%. It is predominant in females and in the age group of 21 to 60 years. Broadly viewing, if we see, the chronic pain has been noted in 45 to 60 years. If we classify the epidemiology of the pain in various diseases, at that time we can observe that the most prevalent pain was of chronic back pain, which was highest, noted as 24.84 percentage, followed by the generalized body pain, that is of the body ache, which we say associated with malaise, that is 22.98 percentage. The pain in the knee, which we can observe, that is 16.77 percentage, that we discussed as the pain of the osteoarthritis or the rheumatoid arthritis. Chest pain, 13.97 percentage, as in we can say the gastralgia, or we can say associated with the IHD. Pain in upper limb, a 10.87 percentage. Other pains had prevalence of less than 10 percentage. This may be the tip of the iceberg, and the actual number may be much higher. If we observe, there is a large number of figures which is present in the pain management. For new pain management guidelines from the Indian Society for Study of the Pain, a wide range of CAM modalities instead of opioids for chronic low back pain, but the recommended complementary and alternative medicine, that is CAM modalities, do not include homeopathy. Whatever the guidelines at present we have by the Indian Society for Study of Pain, they have the given the, we can say, conventional treatment as use of opioids, which we have already seen in our materia medica as bad effects of opioids. But what about those bad effects of opioids transforming, or which can be the triggering factor for production of a new disease in our body? So the treatment for pain which has been suggested is giving us a new disease in our body. So from that point of view, we take it as ailments from bad effects of opioids. At that time, we would be thinking of that who would be using these opioids. But opioids in alternative form also has been used as a conventional treatment for the pain management. But in that CAM modalities, instead of using those opioids for chronic low back pain, the alternative form which we now have adopted as an alternative system of medicine, holistic homeopathy. But that has not been yet included in the Indian Society for Study of Pain Management guidelines. So at present, we have complementary and alternative medicine, that is holistic homeopathy, for the treatment or the management of pain, how which we are going to explore in this session. So before moving on to the pain management, we would be seeing what are the different types of pain and in which particular diseases these types of pain have been found. Based on the types of the pain have been classified by me on the basis of different aspects. First of all, we will be seeing based on the underlying pathology. Then we will be seeing based on the different body parts, based on the development of the pathology inside the body. So first, which we are discussing, that is the types of the pain based on the underlying pathophysiology. In that, first is nociceptive pain. This type of pain has been developed because of the development of the activation of nociceptors in the response to noxious stimuli. Now, nociceptors are one type of receptors in our body which are responsible for the detection of any kind of pain, neuralgic pain, which we are going to see in the next. There are proprioceptors and there are nociceptors. So activation of nociceptors are done in our body whenever there is any kind of noxious stimuli. In the stimuli response pathway, wherever the body is encountered with the any noxious stimuli, at that particular time of period, the activation of the nociceptors takes place, and which results into the production of the nociceptive pain. Now we will be seeing the characteristics of this nociceptive pain. There would be sharp burning pain, which is somatic on the generalized tissue portion, or it may be dull aching pain when particularized to the visceral portion. Visceral portion, it is, we can correlate with examples are also given, that is back pain, headache, neck pain, shoulder pain, pain due to burns and injuries. If we see the back pain, that is a broad aspect. In this back pain, classifying it as somatic or visceral, when it is of the somatic back pain, we have remedies indicating that is phosphorus, sharp burning pain along the spine, that is sharp burning pain. When it is associated with the type of, we can say, the gallstone pain, in that also we are experiencing a back pain. In that back pain, it is dull, aching, visceral pain, which is related to the viscera. Somatic, related to the particular soma, generalized tissue portion. Whereas viscera, that is visceral pain, which is related to the particular viscera, that is any related to the particular organ. Neuropathic pain, central sensitization or neural damage. Whenever there is any damage related to the particular nerve, particular neuron, at that time neuropathic pain develops. And this pain is characterized by severe burning, shooting, or numbing pain, which presents with the increased sensitivity to stimuli. If we see the two aspect of materia medica and organon over here, in organon point of view, we can see that increased sensitivity to stimuli helps us in classifying the patient either into the hypochondriac patient, oversensitive patient, based on the response given by the patient regarding to the stimuli. Severe burning, shooting, or numbing pain would help us in identification of the remedy. At that time, we can say the remedy which would be selected on the basis of the type of the pain, that is severe burning, shooting, or numbing pain. We have remedies like hypericum. We will be seeing the single aspect of the remedies, the key remedies, the key for the particular type of the pain. Examples given are peripheral neuropathy, diabetic neuropathy, trigeminal neuralgia, complex regional pain syndrome, CRPS, neuropathic pain due to spinal injury. All these are associated with the nerve damage, neuronal damage. and so they are producing severe burning, shooting, or numbing pain, which has led to the increased sensitivity to the stimuli. Hyperalgesia and allodynia. Hyperalgesia is particularly related to the increased sensitivity, and allodynia is related with the increased pain sensibility. So these two are, again, we have seen the examples related to it. Mixed pain, where there is a nociceptive pain also and neuropathic pain also. In this, nociceptive pain would be related to the particular stimuli, noxious stimuli, and neuropathic pain resulting from the damage of nerves due to that noxious stimuli. Noxious stimuli damaging the neuronal or nerve damage, causing the nerve damage, is resulting into the mixed type of pain, that is nociceptive pain and neuropathic pain. The characteristics of it are severe shooting pain, or alternates it with dull aching pain. These two are classified on the basis of, again, involvement of the somatic nervous system and nervous system, particularly to the related to the viscera. When it is to the somatic nervous system, at that time severe shooting pain would be there, and when the nerve damage will be associated with to the viscera, at that time it would be the dull aching pain. Examples are LBP, that is lower back pain with radiculopathy, where there is some type of disc embulging, where there is involvement of neuronal damage due to the crossing over of the vertebrae. Cancer pain, the pain related to the cancer detection after the, we can say, the radiopathy and then chemotherapy has been taken. Next, based on the duration, acute pain and chronic pain or breakthrough pain. Acute pain constitutes of the pathophysiology, that is activation of the peripheral nociceptors, accompanied by release of COX enzymes and prostaglandins. These COX enzymes and prostaglandins help in the dissociation of the acetylcholine, which is responsible for the activation of peripheral nociceptors. The nociceptors are the receptors which are being activated with the help of the dissociation of this acetylcholine A and the prostaglandins. When these are getting dissociated, it causes the activation of the peripheral nociceptors. Its characteristics is last from few seconds to less than 6 months. The, we can say, the classification guidelines involves that if any of the pain is lasting less than 6 months, if it is not more than 6 months, then it has to be characterized into the acute pain. Examples, if we see injuries, headaches, which involve the migraine aspect, we can say sprain, post-operative pain, back pain, all these are particularly leading to the back pain, which are associated with the acute type of the pain. Next, if we see, that is the chronic pain, it is with the underlying pathophysiology of sensitization at the level of spinal neurons via multiple mechanisms. Characteristics are it lasts for 6 months, more than or equals to the 6 months, chronic primary pain, cancer pain, post-traumatic and post-surgical pain, neuropathic pain, headache and orofacial pain, visceral pain, musculoskeletal pain, etc. Breakthrough pain. Pain in a well-treated patient due to movement that is incidental, spontaneous, or resulting from the weaning off of the drugs or effect of drug. Weaning off effect of the drugs, we can also correlate it with the drugs involvement of the cancerous treatment of the cancer. In the chemotherapy, we have seen in most of the time that there is involvement of the chemical drugs. These chemical drugs make an habit to the patient, and this helps in to the patient to get associated with development of the, we can say, any type of the pain relieving aspect. At that time, hello, am I audible?
Yes, sir. Please continue, sir. Yes, sir.
Okay, madam.
Hello. Yes, sir. You are audible, sir. Please continue, sir.
Okay, madam. Chronic pain, it is which we were discussing regarding the pains which are lasting for more than or equals to the 6 months. In this kind of the cases, whenever cancer patients which are kept on the, we can say, cancer chemotherapy treatment, at that particular time period, those opioids or those, we can say, the chemotherapy aspect are required for the purpose of giving a support in pain management to the patient. But ultimately what happens that when these opioids are weaned off, that is weaning off of these drugs, makes in the aspect of the breakthrough pain, when there is, we can say, the sudden episodes of the pains takes place. In this condition, patient is going through the big breakthrough pain, and in this breakthrough pain there are the characteristics of sharp shooting pain, there are the characteristics of numb pain. All these things are being characterized on the basis of the duration of the pain. Next is based on etiology. Based on etiology, if we see type, that is cancer pain and the CNCP pain. CNCP are the non-cancerous type of the pain. Cancer pain caused due to cancer itself, for example, brain tumors, breast cancer. Pain due to the drug treatment which is ongoing with the cancer. And finally, the associated disease, that is any neuropathy caused due to the cancer, results again into the particular type of the pain. Characteristic, if we see acute or chronic pain of mild, moderate, or severe intensity with or without breakthrough pain. It may be acute type of pain, it may be chronic type of pain, but depends upon the involvement, or we can say the advancement of the pain. It can be classified again with the, or it can be characterized again with the help of the type of the pain, that is, it is numbness pain or sharp pain. Example, all types of cancers. When we are talking about CNCP pain, that is the non-cancerous pain, it may have multiple etiologies, as we discussed in earlier portion also, that it may be due to the arthritic condition, it may be due to the generalized body ache pain. Characteristics are moderate to severe pain with or without restricted mobility. When we are talking about osteoarthritis, there may be again involvement of the restricted mobility. If we are talking about the rheumatoid arthritis, at that time activity of the daily living will be also disturbed, maybe due to this pain. So at that time we also need to manage the pains. Based types of pain based on the location. First is the LBP, that is the lower back pain. In lower back pain, we can see causes due to the bad postures, which we are now observing in the many of the cases where the adults, because of the, we can say, bad posture, always using the mobile phone while lying down or using more than one pillow at the time of the sleep. So due to the bad postures also, it may cause the lower back pain. Strains or sprains, this may be due to the sudden jerk, or we can say sudden any kind of the movement, which would be causing the lower back pain. Underlying disease, any malignancy or infection, or referred type of the pain, that is kidney or gallstone pain, which kidney pain, kidney stones pain are also being referred onto the lower back pain. Characteristics: mild and moderate to severe pains with or without impaired movement or physical function. This mild and moderate to severe pain may be resulting because of the type of the, we can say, pathophysiology involved into it. If it is going to be kidney stone, it may have severe pains without any physical functional development. Impaired movement no would be not seen. But in the cases of the referred pain due to the gallstones, there would be a dull aching pain continuously throughout the day. Next, if we see the examples, acute lower back pain, herniated disc, spondylosis. Next type of pain is due to that is neck pain and shoulder pain, which may be, again, we can first of all see the incorrect posture, that is continuously bending down while using mobiles and everything, or we can see the extension of the neck while you watching any kind of TV continuously. Compression of the spinal cord or injuries may be also over this, caused due to the strains and sprains again over here. Again, we can see mild and moderate to severe pain with or without impaired movement or physical functions. This classification has been given by ISSP, that is International Study Protocol for Pains. An example they have again provided us with axial neck pain, cervical radiculopathy, headaches, based on again the location of the pain in the head, or we can say the migraine type of pain, non-migrainous pain, caused due to incorrect posture, stress, migraine, or underlying disease. For an example, tumors. Characteristics, it is characterized by associated with migraine, which may present with additional symptoms like aura. This aura is not important for right now for the conventional treatment, but it is very important for the homeopathic perspective. Migraine with aura, migraine without aura, migraine with aura beginning from the head to tip, ascending aura, descending aura. This will help us to identify the type of medicine to select for the particular type of an patient. It would be help in the individualization of the patient. Visual problems or vertigo. Examples are tension type headaches, migraine headaches. The type of the headache would be helpful for us for selection of the simulima. Bend like headache, headache as if somebody is hammering the hundred of the hammers. Pinpoint headache, headache when patient is suggesting with the tip of the finger. Each and every aspect would be giving us another type of a remedy. Last step, that is the referred pain, any kind of the visceral pain that radiates to the surrounding regions. For an example, we have seen already regarding the stone, that is the gallstone, which is the pain is referred or radiating to the back, and particularly to the angle of the shoulder. The characteristic of this type of pain is it may be sharp, pulsating pain or dull, aching pain depending upon the origin. Whatever would be the pathophysiology which we discussed in the first slide itself, that is explaining us that which type of pain it would be causing. Example are given, that is angina, which is the pain is referred to the jaws and shoulders. Stones, the pain has been referred to the abdomen and back. So this was the classification of the pain depending upon the location, based on the location. Up till now, we have covered the types of the pain which were due to the pathophysiology, that is classified into the nociceptive or neuropathic pain or mixed pain. And we have seen the pain based on the duration, in that we saw acute, chronic, and breakthrough pain. Then we saw the pain based on the etiology, cancer pain, non-cancerous pain, based on the location, lower back pain, neck pain, headaches, and referred pain. Now we will be seeing the mechanism of the development of the pain, how the pain develops in upper body of a particular organism. Pain is basically a protective mechanism of the nature, and it actually gives warning to the sufferer to withdraw the distressing stimulus. Pain, if we see, it is in itself is not a disease, but it is a type of a sign, it is a type of a symptom. This pain is developing as a part of a response to the stimulus. This response helps the individual, it is a warning sign for the individual that the pain through which it is suffering, it is due to the particular type of a distressing stimulus. We have to remove this distressing stimulus, which would be lead into the management of the pain, which would be help the organism to get free from the pain. Most of the pain resolves by removing such noxious stimuli. The distress that arises by the pain are lack of attention in work, reduced mental flexibility, inability in information processing, anxiety, depression, fear, anger, etc. This distressing, these are the examples of the distressing stimuluses. For an example, a bank manager comes and complains about the migraine. For that migraine, the exciting triggers are the stress at the workplace. If this stress at the workplace is being removed, or we can say the stress which is being taken due to the workload, would help that particular bank manager to manage his pain. Pain due to any type of anxiety, pain due to any kind of tension, any kind of, we can say, the depressive aspect, fearful condition also responses into a particular type of a pain, continuously being in an anger condition, irritability, all these are resulting into the pain. And if we go to the GNM theory, the development of the pain in particular type of an organ or in a particular type of an part of a organism is something connecting with the type of the stimuli which is distressing the organism. If it is back pain, it, as it is being said, that it is due to the over responsibility of the family. If it is particular type of the pain in the chest, it is explaining that this pain may be due to the over anxious condition of the child. If there is in the particular pain in the particular hand, depending upon the hand also, right hand and left hand, it also signifies a cause which is responsible in the family aspect. So the modern GNM theory is helpful in identifying the distressing stimuli and addressing the type of the pain. It is one of the major causes which may drastically reduce the patient's quality of life. It is an obvious aspect that when an organism is under any the condition of the pain, it would be difficult for him or her to continue his daily routines, daily chores, and it would be resulting into the decreased quality of the life. So we have taken this aspect of the pain management in helping the patient to achieve its higher purpose of life, to achieve the higher goal of the life. Next is pathophysiology of the pain. How the pain has been developed. The previous slide we saw the mechanism of the pain. Now we are going to see that how this pain is being developed in our body. Stage one is transduction. That is, we saw the nociceptive stimuli of the tissue damaging potential, which includes mechanical and thermal stimuli, are converted by the sensory cells into action potentials. Action potential is a phenomena which is being resulting due to the particular type of the stimuli. In physiology portion of the nervous system, we have studied that how an action potential is initiated. This action potential is helpful in the transmitting the signals all over the body. But when the signals are resulted due to any nociceptive stimuli, that is any noxious stimuli, which is resulting into the tissue damage, this tissue damage is causing a response in the form of a pain. So this nociceptive stimuli of tissue damaging potential, which may include any type of a mechanical stimuli, any type of a chemical stimuli, or a thermal stimuli in case of burns or chills. These are converted by the sensory cells into the motor aspect into the action potentials. And this begins the development of the pain in an organism. Stage two is transmission. Involves the conduction of these action potentials along afferent neurons to the DH of the spinal cord. DH means the, we can say, the gray matter and the white matter of the spinal cord, where there is any causes of the nociceptive stimuli. We have studied that there are two types of neuron, afferent neuron and efferent neuron, and mixed neuron, which is consisting of both of these types. So when these action potentials are transmitted through the afferent neurons to the spinal cord, it causes the transmission of the pain stimuli to the central nervous system. Central nervous system, when is being encountered with this type of nociceptive stimuli action potentials, it is going to the stage 3, that is modulation, where the coding of the nociceptive information occurs at the level of the spinal cord. Modulation of at the level of the spinal cord can be excitatory or inhibitory. If we see, the responses of a particular stimuli may be of the two types. It may excite the particular stage of an organism, or it may inhibit the stimuli, or it may inhibit the response. Modulation can be again on the basis of this of two types, that is excitatory or inhibitory. If it is of excitatory, it is going to give us oversensitive aspect, and if it is going to be inhibitory, it would be giving us the indolent unaffection towards those nociceptive pain, which may be increasing or decreasing the resulting pain. The last stage, that is which is involving the generation, that is what kind of response would be created on the basis of the modulation. It may be autonomic, affective, cognitive, and behavioral responses. Autonomic, at that time, the person is not aware about any kind of the changes which are taking inside the body, and the patient is only and only feeling a type of a pain. On the basis of the type of the pain, we have to go through this pathology, and we have to find out that which is that nociceptive stimuli which is resulting into this type of the pain. Affective, at this time, affective time, the patient cognitive and behavioral responses. Behavioral responses are because of the continuous pain aspect. For an example, if we see, the patient becomes irritable, jealous, or we can say the patient becomes angry on the trifles. All these kind of the anger, irritability, rage are resulting due to this kind of the continuous pain, which is involving the generation of the pain, and it is leading to the perception. Responses to the painful stimuli leading to the pain perception. Now we will be seeing the pain management, and the first aspect would be of a homeopathic viewpoint. Why these pains are so much of importance to us. Need for individualized pain management. In homeopathy, totality of symptom is the foremost important thing in any case. But in the fast moving time, special modulation is needed for keen understanding of any disease, because it is almost possible for a single physician to know and tackle all cases and perceive the nature and prognosis of the illness. Conventional therapy has so many limitations in pain management where homeopathy can contribute a lot. Only opioids and other things has been related to the pain management. But in homeopathy, to the particular type of the pain, we have particular type of the remedies. And in that particular type of the remedies, we are going to see the individualized aspect of the remedies. So it's time that a special emphasis may be given in such pain cases, irrespective of the fact that absolute cure is possible or not. Need for individualized pain management. For the treatment of any diseases, the anamnesis is needed in each and every case. But in these cases, a special reference must be given to the character of the pain. Anamnesis means recalling the past history. Whatever has happened is responsible for the current condition of the patient. So, anamnesis in the pain management is of utmost care. Why? Because we have to see the patient, the pain of the patient, the character of the pain of the patient in terms of location, sensation, modality, extension, and nature of the pain, along with the intensity the associated symptoms and underlying pathological or psychological condition. For example, if we see regarding the gallstone, the location of the pain referred onto the back of the pain, where there is the angle of the scapula is meeting on the right side of the organism. That is our location. Sensation, dull, aching pain. Modality, which may be referred on lying on the back, lying on the side, right side. Extension, the pain which has been starting from the portion of the abdomen is extending towards the back. Nature, dull aching pain, very with the very less intensity, and continuously associated symptoms we can see are the indigestion, blotting of an abdomen, belching, and the underlying pathological or psychological condition over here is of the gallstone. So need for individualized pain management over here is resulting from the anamnesis, and this anamnesis helps us to individualize the patient for the particular pain management. So these are the terms which are required for the pain management, that is location, sensation, modality, extension, nature and intensity, associated symptoms, and the underlying pathological or psychological conditions. Next, if we see the Organon point of view, where what Master Honeyman has written about the homeopathic aspect of the pain management, we would be seeing the different aphorisms which would be helpful for us to identify that how the pain management can be done. Pain, which is the mind, important here in such cases. Is psychological aspect important in this kind of cases? Pain can be a matter of pathology, emotional trauma, bad luck, misfortune, and does it need much of the circumspection as it is a local malady? So we will be seeing the how we are classifying it into the disease classification. Do we take a proper history, or we need to just prescribe specific medicines like arnica, bellis, hypericum, etc.? All the 3 points which we have discussed over here are of utmost importance. That mind, the psychological aspect is important as it is reflecting on the somatic plane. Pain, which has been reflected on the somatic aspect, may be due to a particular type of the pathology. What emotional trauma has caused this pathology? That also need to be addressed. And finally, what we have discussed right now, that is anamnesis. That point also has been challenged, that do we take a proper history in cases of this pain, or just we need or prescribe any type of the homeopathic remedy on the basis of the characteristic of the pain? So here is the answer to those questions. Aphorism 138, here Master Henneman explains us about the experimenter aspect, that whenever there is pain has been observed, we have to exercise over the whole aspect. It is here the patient individually is to be identified on the basis of the peculiar constitution, dispositions, and different types of the symptoms. All the sufferings, accidents, and changes of the health of the experimenter during the action of medicine is essential, are solely derived from this medicine, and must be regarded and registered as belonging peculiarly to the medicine and as the symptom of the medicine, even though the experimenter had observed a considerable time previously. And that's why the point of anamnesis comes over here. The reappearance of these during the trial of medicine only shows that this individual is, by virtue of his peculiar constitution, particular disposition, to have such symptoms excited in him. Next, in aphorism 139, Master Hahnemann also continues explaining the development of the pain. Sensations, sufferings, accidents, change of health, all are causing a particular type of the pain. He who makes known to the medical world the results of such experiments becomes thereby responsible for the trustworthiness of the person experimented on and his statements, and justly so, as the weal of the suffering humanity is here at stake. These particular characteristic type of the pain would be helpful in identifying the medicines or stimulum for the particular pain. In aphorism 256, Master Henneman extends, if the patient mentions the occurrence of some fresh accidents and symptoms of importance, signs that medicine chosen has not been strictly homeopathic, even though he should good-naturedly assure us that he feels better. Here we are taking account that when there is not proper availability of any anamnesis or not any proper availability of the history, at that time when we are just giving a particular type of remedy on the type of the pain, characteristic of the pain, at that time also the patient should not get aggravated but should be feeling better. Classification of the disease condition, that pain is not a disease, it is an important factor which we already discussed. Here is the definition which we have seen about the acute disease, that to which man is liable are either rapid morbid process or the chronic disease state, that is the true natural chronic disease are those that arise from a chronic miasm. Acute condition and chronic condition would be leading to the type of the acute or chronic pain. Now we'll be seeing the rubrics from the Kent's repertory regarding the pain management, which would be helpful to identify the particular remedies. These are the types of the pain sensations, that is aching pain, biting pain, boring pain, burning pain, burrowing pain, bursting pain, cramping pain, cutting type of pain, drawing pain, dull pain, pain as if foreign body is present, gnawing, grasping, grinding, grubbling, hacking, jerking. Aching pain, that is continuous dull pain. Symptoms may be resulting into the restlessness, nervousness, where associated with the vertigo. All are these symptoms and the remedies associated with it. When there is restlessness, calcarea floor is the aspect, and associated with vertigo, simicifuga can be thought of. Head pain, deep aching pain, where there are the remedies like aconite, arsenic, colocynth, medorinum. Urinary organs, when there is dysuria, aching in vein, prostate pain, aching, thuja can be thought of, urethral pain, which is aching, where we can see bryonia, cantharis, eupatorium, genitalia, where male genitalia would be paining, aching, arnica, china, female genitalia pain, which would be again that is aching. At that time, calcarea force would be thought of. Back pain, carbovage, where there is sacral alternating with aching in occiput. Extremities, due to the corns, again aching pain would be there. Entim crude, lycopodium, sleeplessness. Staphysagra is the good remedy for aching type of pain. Biting pain, localized sharp form of pinching, deeper burning symptoms, and remedies would be seeing that is head, mesarium pulsatilla, ear pain, lycopodium, phelanum sorinum, face eruptions, biting sensation, like bryonia, mercurus, netromure, urinary organs, again painful, biting pain seen in urinary organs, carboanimalis, conium. In case of extremities, eruption we've seen in elbows, again biting type of pain. Kali nitricum is the indicated remedy. Itching type of pain in extremities resulting into the biting pain, that is calcarea carb. General itching, biting pain in upper limbs, berberis could be thought of. Boring type of pain, if it is seen in head, stitching, boring, ammon carb. In male genitalia, due to test pain in the testes, boring pain in the testes, that is plumbum, cilicia, larynx, cocculus could be thought of. Corns, because of the causticum and calcarea are the remedies. If in the we can see the your corns are responsible for the dull aching type, at that time antim crude was the indicated remedy. But when if it is the boring type of pain, calcarea carb, causticum, natrum carb are the remedies. Burning pain, hot like fire burning pain. We have symptoms like if it is in the head, then we have nux vomica, alumina, aloes, eye burning pain, burning stitching pain in the eyes related to the euphrasia, abdominal pain resulting by the graphitis, cocculus, urinary organs pain because of the ambrosia. We can see lysinum, phosphoric acid, male genitalia, phosphoric acid, extremities, bufo, colocynth, gelsemium. Burrowing type of the pain, at that time we can see the spigelia, squilla, ear pain, entim crude, ammon carb are the indicated remedies. Extremities, we can see the clematis in the fetus, the burrowing pain in the upper arm, pressing pain, bursting type of the pain, the explosive pain because we can see the symptoms. If the head pain is of type of a burning sensation, bursting sensation, alumina is the key remedy, argentum nitricum, simissifuga, glonoin. Eye inflammation, bursting pain, again Staphylococcus is the good remedy. Staphylococcus has been indicated as the king of the pain remedies, where most of the type of the pains are being cleared by the Staphylococcus. We do also know about the trio of the pain. Male genitalia, bursting type of pain if it is seen due to the coiling of the spermatic cord, that is Kaliyas. Cramping type of pain, on and off type of intensity is seen. Most of the type of the muscular pain. If it is seen in the head, it is phosphorus, kali, nitricum, sulfur. If it is seen in male genitalia, nux vomica, kali carb, argentum metallicum. If it is seen in the extremities, with the help of a crampy, wristy, arching pain, cutting type of pain, we have, if it is in the head, and again we have belladonna, meconium. If it is in the urinary organs, bladder cutting pain, then it is again we have colocynth. If it is seen in the male genitalia, again phosphoric acid, drawing type of pain like pulls inwards. If it is in the head, that is petroleum is a good remedy where pain is preceded by drawing in armpit. Abdominal pain, cutting, drawing pain in abdomen, valeriana. Dull pain, again in stomach, emptiness, weak feeling, faintness. If it is in the head pain, again jerking type of pain, alternating with dull aching pain. These are the types of the symptoms and pains we can see. Foreign body as if sensation. If it is into the head portion, then it is the conium is the indicated. Throat internal having foreign body, sabadilla and valeriana is again the indicated remedy. Gnawing pain, the definition is that is intermittent intensity, annoying, chewing type of the pain. If it is again in the head, ranunculus sulvosus, that is gnawing pain. Rectum pain, gnawing type of pain in rectum, that is carbo veg, ellipse, ferrum metaculum. Grasping type of pain, that is squeezing or pulling type of the pain. At that time, if it is in the head, argentum nitricum, arsenic are the indicated remedies. Grinding type of the pain, which involves the motion, wearing smooth by friction or motion. If it is in the head, that is agaricus, anacardium. Grumbling type of pain, chronic changing but constantly there. If it is to the head, then it is heparsal, indigo, sulfuric acid. Hacking type of pain, where there is cutting pain, notch type of pain, slicing pain. This all are, if it is seen into the head, then we have ammon carb, arsenic, aurum, kalinitricum, lycopodium, and phosphoric acid. And the choking pain, where the pain makes you move, not a pain, it's like something that happens in the body. Sensation as if choking also we can take into the consideration. If it is seen into the head, then stitching, jerking type of the pain, we have netromure, lux vomica, and pulsatilla. How, when we are managing the pain, how would we assessing the pain? The assessment of the pain in the particular follow-ups after the first prescription can be assessed with the help of this visual analog scale. Visual analog scale helps us in identifying the type of the pain which is being responsible in the cases of the production of the pain. VAS scale, that is visual analog scale. This visual analog scale helps us in assessment of the intensity of the pain, how the intensity of the pain has been increased or decreased during the particular type of the ongoing homeopathic treatment in the patient, ranging from 1 to 10 on the basis of the gesture of the patient. If it is onto the no pain type, if it is onto the mild type, moderate type, severe type, or unbearable type. And on the basis of this types of the pain, from no pain to unbearable pain, the assessment scale ranges from 1 to 10. If it is onto the 10 score, that is severe, reducing to the 9 intense, 8 would be unmanageable or unbearable, 7 would be distressing, 6 that is distracting, fifth, moderate, fourth, uncomfortable, three score related to the mild, two to the minimal, and last one, no pain. So if we see the pain management on the basis of the pain measurement, in that if we see onto 0 to 5, at that time it is no pain, mild, moderate, severe, or unbearable. If we see onto the 10 score aspect, we have this following particular phases recognition of the patient during the follow-up stage. So visual analog scale helps us in establishing the scientificity of the homeopathic treatment. That if we say whenever that with the help of homeopathy, the pain of a particular patient has been gone, they ask us what is the validation, what is the scientific involvement of the homeopathic system of medicine. At that time, the pre-VAS scale score and post-VAS scale score would be helpful for us for assessment of the homeopathic treatment and establishing the scientificity of the homeopathic treatment. So VAS scale would be very much helpful tool, assessment tool to identify the scientificity of the treatment which we have been given to the patient. So with that, I'm ending the session and the forum is open for the any type of questions for the particular cases of the pain management in one organism. So is there any questions or queries regarding the pain management aspect which we have discussed at present?
Sir, there are a couple of questions from the participants, sir. So, actually, the question is, how can a simulum can be selected on the basis of a pain? This is the question, sir.
Simillimum can, the characteristic type of a pain would be helpful for us in selection of the remedy. For an example, if a patient of a gallstone comes to us, dull aching pain would be the pathological aspect, and it would be, we can observe it as a general symptom. But when patient of a gallstone comes with sharp shooting pain, at that time we need to identify which type of remedy we need to give them. The type of the pain, the characteristic aspect of the pain would be helpful in selection of the remedy. If we see the example which I had given, in all these types of pain, the first aspect which I had taken was about head pain. That if it is burrowing pain, the selection of the simillimum would be entemtart, Baraita arcatum, chamomilla. If it is type of a bursting pain in head, then we can select alumina, argentum nitricum, or glonal. So the simillimum for a particular patient changes on the basis of the type of the pain. So type of a pain, characteristic aspect of a pain helps us in selection of the simillimum.
Sir,
And,
there is a second question, sir. One more question from the participant, sir. How should we give relief to acute episodic attack of a pain in a chronic ailment in homeopathy?
okay, at that particular time of the aspect, posology comes into the role. So if the acute attack can be taken as acute exacerbation of the chronic disease. In this acute exacerbation of the chronic disease, first of all, we have to see that what is the trigger, what is the exciting cause that has caused the acute attack of the chronic ailment. If a patient of lumbar spondylosis suddenly has a particular type of pain increment, we have to assess the causes of that sudden pain. Has he traveled in past days, or he has overstretched his back, or any kind of weight has been pulled up by a particular person who is suffering from this lower back pain? So on the basis of the cause, on the basis of the exciting factor, on the basis of this triggering factor, we would be helpful in identifying the cause of the pain. So when cause of the pain would be identified, next moving on to the type of the pain. So type of the pain would be helpful in identifying that it is a nociceptive pain or a neurogenic pain. And that would be helpful in selection of the remedy. After selection of the similimum, we can go for, if it is very severe acute pain, we may select LM potency and frequent repetition of the doses would be done. And if it is not that much severe aspect, if it is dull aching pain, at that time again we can take a particular potency single dose and manage the case.
Thank you, sir. Thank you so much. Any other questions from the participant? They can comment in the comment box. Sir will be answering. Yeah. I think they have cleared the questions too, sir. They are perfect with the topic. Thank you, sir. Thank you so much for the overwhelming session. It will be great knowledgeable for us to learn regarding the pain and the types and its different remedies which can be prescribed at that particular different type of pain and different kinds of disease conditions. Thank you all the participants also for your wonderful engagement in the webinar and clearing out your doubts also. So tomorrow we'll be right back with the one more session. So stay tuned. So thank you, sir. Thank you all the participants. Yes, sir. Thank you so much. Looking forward for many more sessions, sir. Yeah.
Thank you, ma'am.
Thank you, sir. Thank you so much.